If you're struggling with knee pain, then this video is for you. I want to dive right into the real reason so many people deal with knee pain. But if you stick around to the end, I'm going to show you some physical therapy exercises, 3 in particular that are probably making it worse. And I know because I've seen them done and given out in clinics, not this one, but in clinics that I've worked with in the past. So let's get right into it. The 3 physical therapy exercises that people do that cause them more pain. Number 1 is bending through your knees when you do a squat. So I've been to people's houses, we did home health, and I would change their programs around because the person who went before me would tell them they need to do 30 squats twice a day. And I say, okay, show me the squats, and they do this. That doesn't look very good. I'm only using these muscles right here. If I poke, this quad muscle's doing all the work right here. And if that quad muscle's tight, it's pulling my kneecap into the joint and it's compressing. And that's gonna cause irritation over time. I have to be able to distribute that stress. So we should not be doing squats that are knee heavy. We should be doing squats where we shift our hips back. We gotta distribute that load into the back of our leg. And we have to retrain it. So making sure that we're not doing squats, knee heavy squats, that we're not bending through our knees. When we're trying to do exercises, we shouldn't be just dropping into our knees all the time, trying to strengthen them up, because if we already have inflammation, that's gonna make it more inflamed. Number 2 is a quad stretch. So everything feels tight on the front side of the leg. So then you'll go here and you'll grab your quad and you'll be stretching it. But a lot of times that's not gonna make it better. That's gonna make it worse, because what's happening now, I've tightened up all this chain of muscle tissue and I've just compressed that kneecap into the joint, and now it's getting more irritated and more inflamed. We don't want to do a quad stretch on the front end of our rehab because it's not going to help us. We already are inflamed. We have too much inflammation in there. It's irritated. We're just irritating it more. If we're going to do something to loosen up the quads, we actually have to get in there and massage those muscles, loosen up that muscle tissue so that we can increase glide. Think about it like my shorts as being the muscle. If my quad is attached down here, it's my shorts, and then it's all tight, and then I just tighten it up even more, it's gonna cause even more compression. I wanna loosen that up. So if I loosen this tissue up, it's gonna take the stress off of the knee. So we wanna get away from the quad stretch and really start looking at using a massage roller or a foam roll. You don't have to get on a foam roll, but a massage roller or a massage gun to loosen up the quads on the front end. First 2 weeks is really important that we're not doing exercises that aggravate the injury. Number 3, a lot of physical therapists will tell you to screw your feet into the ground when you're doing a squat. So they'll go right here, they'll say, screw your feet into the ground. So we're externally rotating like this. I've seen so many people tweak their knee when they do that. You do not have to screw your feet in the ground. The concept and the reason that they're doing it is because they want you to use your glutes, because the glutes, a lot of the glute muscles do external rotation, the big ones. But what happens there is that now you can see that I'm twisting up on my knee and I'm just grinding this joint together. What works really well is to have a subtle pressure, just a little bit of pressure pushing my feet apart. So 10% is what we always tell our clients. It's like when we want to engage the glutes, give me 10% pressure like you're trying to rip the carpet, like you're trying to spread the carpet fibers apart. So I'm just 10% little pressure, and then I do my squat, I kick my butt back, and I'm allowing my knees to bend, but my hips are leading the motion. So making sure that we're not screwing our feet into the ground, because that's actually gonna grind the knee. We want to avoid that. If this video is making you think twice about the physical therapy exercises that you've been given, then hit the subscribe button. Make sure you hit the bell icon so you don't miss out on any content that we post. The things that we do here in the clinic, we post online, and they actually work. We're giving you the information that'll get you out of pain. So if the real reason that you're having knee pain is that you're using your knee too much, what should you be using? What joints? We should be using our ankle more and using our hip more. But a lot of times we have problems with those areas, and that's why we're having the knee pain. We've got to fix all 3 together. So a very simple thing that we look at in the clinic, we'll have somebody do a lunge and we'll see, hey, how do they control their knee? Well, that control is actually coming from the hip. So the reason that they're having knee pain is that when they stand on one leg, that knee wiggles all around. they can't control it. So the hip is controlling the femur, which is attaching to the tibia right here. So if I can't control this bone up here, then it's wiggling, 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 and that my foot is attached to the ground. So this stays still and this just wiggles on it. So if I wiggle a joint together, wiggle two bones, I'm just grinding on that cartilage. So we've got to get our hip control. And we have videos that we'll link in the description below on exactly how we fire up those muscles, and then we keep them fired up so that you don't continue to go back to physical therapy offices or chiropractic offices trying to get a fix because you're not getting a full fix from the beginning. Got to make sure that we're getting that hip control first. Number two is that we need to rely on our ankle. Our ankle needs to be able to bend. When we're walking, it needs to be able to bend to 10 degrees. So if I'm stepping through right here, my ankle needs to be able to bend to 10 degrees. If it doesn't, then my knee will bend early. And so then again, I'm using my knee too much. So I've got to make sure that I have good ankle flexion, dorsiflexion. So it should be able to bend up really well. If you're running, we should be able to bend to 20 degrees. So getting down in this position, my ankle should bend a lot. And I've sprained my ankles hundreds of times playing basketball and sports growing up, but I don't have ankle problems because I'm managing it. I make sure that the muscle tissue is loose and glides and that the muscles are strong and stable around them. Everybody's gonna struggle with some type of pain at some point. Our body is amazing that it's able to heal if you do the right things, but you have to have the right information. So we need to make sure that we have great ankle mobility and strength and great hip mobility and strength. And that's what's gonna take the stress off of your knees when we do those two things and then get really good movement patterns. On this channel, we post videos consistently on how we fix things in the clinic. In 2024, we had a 92% success rate. In 2025, we had a 94% success rate. The way we measure that is if somebody hits their number one goal and that they're happy that they came to work with us. And so that 6% grinds my gears. We're gonna make sure that we close that gap. I wanna make sure everybody gets better. And the reason we have this channel is that we want people to get the correct information out there. And on our channel, we're just posting what actually works with people. So we'll see you in the next video. If you have any questions or concerns, if you need more clarification, let us know, leave us a comment. We'll see you in the next video.